If you've seen the film Something's Gotta Give, you know the scene I'm talking about. And if you haven't, let's just say it involves a heart attack, very bad timing, and a very awkward hospital conversation with the doctor. You remember the one. That scene has been making cardiac patients laugh very nervously for over 20 years because the fear is real. Can I still have sex? Will it hurt my heart? What if something happens? Today, we are going to answer that properly. That movie scene might be fiction, but the issue hits home, and it's one of the most common unspoken and unanswered issues that heart patients have to face. Everyone, trust me, everyone wants to ask, but it often doesn't feel like it should take priority in a 10 or 15 minute review. And it's definitely something that feels awkward to bring up. Oh, and doctors won't bring it up on their own, trust me. Research backs this up and shows that more than 4 in 10 patients say that they need this information, but they never got it. That's not good enough. So let's fix it right now. I'm Dr. Jodie Ann Senior, a heart failure specialist, and this is one of the most important conversations I think we can have. By the end of this video, you will know whether it is safe for you specifically, how your medications can affect your sexual activity, and the one question that you need to ask your cardiologist. This all takes less than 10 minutes. So, can you have sex with heart failure? For most people with stable heart failure, the answer is yes. Yes, you can. And I'm going to show you exactly why that answer is medically sound, not just reassuring. Here's how cardiologists think about the physical demand of sex. We measure physical effort in something called METs, metabolic equivalence. You don't need to know that term, but what you need to know is this. Sexual activity at its peak requires roughly the same level of effort as walking up 2 flights of stairs. You remember Jack, 2 flights of stairs. That's it. If you can manage that without stopping, without severe breathlessness, without chest pain or dizziness, your heart is already managing a comparable workload or level of effort. The American Heart Association and Circulation documented this in 2012 and Princeton in 2024. I'll share the reference in the description below. Now, some of you may have read that sex barely increases your risk of a heart attack at all. An increase from 1% annual risk to 1.01%. And that's good data. It's very reassuring and broadly true for people with stable coronary heart disease. Sex-associated sudden cardiac death across 26 years of data accounts for just 0.2% of all cardiac deaths. So sexual activity is safe for most when on optimized therapy, but up to 1 in 3 people avoid it due to fear alone. For heart failure specifically, the risks are a little different. They relate to the demand on your heart muscle and, for some patients, to heart rhythm, which is exactly why where your heart failure sits right now matters and what I want to cover next. Heart failure is not the same for everyone, and the honest answer to this question depends significantly on where you are with your heart failure right now. If your heart failure is stable, meaning your symptoms are mild or well controlled, you're not carrying excess fluid, you're on medications that are stable, and you feel reasonably well day to day, then you are almost certainly in a position where sexual activity will be safe. This is the majority of people watching this video. If your symptoms are more significant, if you're getting breathless with very light activity, or if you've been in hospital recently, or if your heart failure is not well controlled right now, then this is a conversation to have with your cardiologist before you resume. Not because the answer is going to always be no, but because you may need stabilization first and you need to be assessed. And if your heart failure is at its most severe right now, let's face it, you probably don't even feel like it, but at least wait, get stable. The goal is always to get you to a point where more of life is available to you, not less. A simple way to know where you sit. Can you walk up 2 flights of stairs without stopping, without severe breathlessness or chest pain or dizziness? If yes, the evidence is on your side. If you're not there yet, then work with your team to get there and bring this question to your next appointment. If you have been told that you have a significant cardiomyopathy, a very low ejection fraction, a history of dangerous heart rhythms, or you have an implantable cardiac defibrillator, your situation needs individual assessment, not because sex is off the table, but because the risk picture is more specific and you deserve a specific conversation with your cardiologist, not a general one. If you have an ICD, ask your device team to include a plan for sexual activity. You may be surprised by how reassuring that conversation is. Now, let's talk about your medications, because some of them matter here, and there is one thing I need you to hear really clearly. If you are taking a nitrate, that includes tablets under the tongue, sprays or patches, or long-acting nitrate tablets, you cannot take Viagra, Cialis, or any medication in that class for erectile dysfunction. Not under any circumstances. The combination causes a severe and dangerous drop in blood pressure. If you're on a nitrate and you want to discuss options for erectile function or sexual health, that conversation happens with your cardiologist. There are pathways forward. They just need to be managed carefully. Beta blockers, which most of you will be on, can reduce libido and can contribute to erectile dysfunction in men. This is real, it is documented, and it is not in your head. If you've noticed a change since starting your heart medications, then please tell your doctor. Not all beta blockers affect this equally, and there may be adjustments worth exploring. Do not just stop your beta blockers. Overall, well-managed heart failure treatment improves your chances of safe, satisfying sexual activity over time. Your medications are working for you. Work with your team, not around them. Please choose a time when you're more rested, not straight after a large meal, not in extreme heat. These things increase cardiac demand and they're easy to plan around for sex. Positions that require less physical exertion place less demand on your heart. Being more reclined, or being the less active partner, or being the one on the bottom meaningfully reduces effort. This is not just common sense, it is in the cardiology literature. You may need to bring a little bit of imagination to your intimacy to help make it work. If you become very breathless during sex, stop and rest. Do not push through it. Use the same logic that you'd use with any physical activity. If symptoms don't settle, call for help. Your partner's fears also really matter here too. Many partners are more frightened than the patient themselves. And if that's the case for you, bring that conversation to your cardiologist together. I hear this all the time. The man's like, when are we going to start sex? Is it safe? Can we do it? And the woman's sitting there going, oh my God, please don't talk about this. I'm too scared something's going to happen. I don't want you to die. This is what I hear all the time. Both of you deserve to hear the answers from the same person at the same time. Now, I want to say something directly to the women watching this. Most of the research in this area with heart failure has been done in men. That means your experience, the changes in desire, in intimacy, in how your body feels, this has been under-researched and under-discussed and is therefore underserved. Research published in 2023 confirmed that women with heart failure are navigating this in real time and significant ways, and that they also need information to help deal with fears around intimacy and sex. And you have every right to that information, and we need to elevate our game and do more research in women. And your cardiologist should at least be able to provide you with an informed discussion that might help you navigate it better. So, here's one thing I want you to do after this video. Ask your cardiologist directly, is it safe for me to be sexually active? And do my current medications affect this? Most doctors will not bring this up. That is a gap in our system, not a sign that it doesn't matter. It matters. You are allowed to ask. You are allowed to want this part of your life. So, back to the question, can you still have sex with heart failure? For most people who are stable, yes. The physical demand is modest. The risks are real but manageable. Your medications can be navigated, and you deserve to have this conversation properly. So, if this helped you, please share it. There are people who need to hear this and will never bring it up in a consultation. And if you want more honest answers to the questions you're actually asking, subscribe. I'm here every week. If you'd like to read more about this topic in depth, then I've written an article that covers this in more detail, particularly the medication risks and the effects. The link will be in the description below. Take care of yourself. You deserve a full life. All of it.